We have a thread a little bit thinner with bigger cogs to fix the thread better inside. In 3D thread, we have thicker thread with a smaller cogs to fix the whole result which we have obtained. Our idea is to place pull cogs in the middle part of the face to lift it up and to lift the low part. It's not needed to inject so many anesthesia in temporalis area. Usually I dilute 0.5 with 1 cc of physiological solution and inject in temporalis area to be able to place my thread under the skin always on the same depth. This is a line of the opening of the jawline. The idea is to put threads as even as possible. Faces are individual. Some faces are short, and we have possibility always to begin to start to work inside the hairline, like here. So after the insertion, I go under the skin. So I place my cannula up to this line, I don't go more. And then I do the same, push the thread and withdraw the cannula. When you begin to work with this technology, please don't try to pull the thread when you apply it. Apply all 4 threads and then pull all together. In case I will create the big lifting already with the first thread, second thread will be, for me it will be more difficult to inject because I should go through the skin which has been shrinked. That's why I do it later. We do the same on another side. Seeing that the face of the patient is not long, I cut the thread here. So I push the thread and cut it here. And as you see this side, I have done 2 points of insertion just to show you that it's not strict. You can choose the points of insertion where you want. You can put 1 or 2. For instance, you can put 2 threads from one point and 2 threads from another point of insertion. Also, I would like to once again underline why I don't use anesthesia here. Because I would like to place threads as far as possible from vessels and nerves. So patient will have much more comfortable post-treatment period. We have a choice to create overcorrection, and our patient gonna have better result later. I can create hypercorrection and fix it with 3D, and then our patient gonna have excellent result. Or I can leave it without, leave her without small folds. Our patient is looking for the result, so she has chosen overcorrection. I would do the same on her place. I will pull the skin. Move the skin in upright position. Then I push the thread, and then I withdraw. This is it. I not really care about a small fibrosis of 2 millimeters somewhere in the temporalis area or in preauricularis area, but I more care about too many thick threads in one place, so it will create artificial papilla after. And of course, we should tell to our patient to limit their activity, physical activity of the body and mimic activity of the face. Please don't force your face, because by that you can lose part of the result. Yeah, and you can move threads still. Fixation mask, it's necessary in this case because face has their weight, and during mimic activity of the patient, the effect will become less. Anyhow, she will lose about 15% of result.